Hello, everyone. I'm Lana. Thank you so much for joining me. Some Americans could be eligible for COVID-19 booster shots in about 2 weeks, but others will likely need to wait. The Biden administration had hoped for a full booster rollout by September 20th, but on Face the Nation Sunday, Dr. Anthony Fauci said that while the approvals for both Pfizer and Moderna boosters are moving forward, there's still more work that needs to be done.
In some respects, it is. We were hoping that we would get both the candidates, both products, Moderna and Pfizer, rolled out by the week of the 20th. It is conceivable that we will only have one of them out, but the other will likely follow soon thereafter. We are doing studies right now, which are just what you said. They are mix and match studies. Namely, we're lining up Pfizer against Pfizer, Pfizer for Moderna, and vice versa. Hopefully, within a reasonable period of time, measured in a couple of weeks, we will have that data. But right now, we are suggesting, and hopefully it will work out that way, that if you got Pfizer, you will then boost with Pfizer. If you get Moderna, you'll be boosting with Moderna. But we are doing the studies to determine if we can do just that, switch one with the other.
As of this weekend, 176 million people in the United States are fully vaccinated. That's about 53% of the total population. But COVID infections are on the rise. The push for booster shots comes as the Delta variant spreads across the country. The CDC reported nearly 160,000 new cases in the U.S. on Friday alone. Joining me now is Arthur Caplan. He's the director of the Division of Medical Ethics at New York University's Grossman School of Medicine. Arthur, thanks for being here. I want to begin by discussing Ivermectin, which has been circulating on social media as a type of alternative, unproven treatment for COVID. Actual medical studies have shown so far that it does nothing to treat COVID-19, but demand is still spiking. Tell us what exactly ivermectin is and why this has gained this type of social media amplification.
Well, Lana, ivermectin, made by Merck, was developed literally 40 years ago to fight worms in humans. There was a huge problem with guinea worm in Africa, and this thing killed the worms. It was then realized you could apply it to animals that also get worms, like sheep, horses, and even dogs. And so it became the #1 dewormer medicine. There were some doctors and some individuals who said they thought this drug might have an effect against COVID. I think it's utter nonsense because there's no reason to think a dewormer drug would kill a virus. It wasn't intended for that. Probably the most persuasive reason not to use it, not to tout it, is that the manufacturer who would make money from selling it, Merck, is urging people not to use it.
So the manufacturer is saying don't use it. As I understand, the FDA and the CDC have also issued warnings about people misusing it. And people are actually getting sick off of this, Arthur. Tell us why it's potentially dangerous for people to misuse this drug.
Well, one huge problem is you can buy some of this stuff, say, at a agricultural supply house. The doses are intended for horses, not for humans. So there are plenty of cases now of people showing up in the ICU overdosed on ivermectin. It can kill you, can cause seizures, can cause terrible, if you will, high blood pressure in the brain, which can cause brain damage. I think there have been at least a few deaths now from ivermectin. So you don't want to use something intended to kill worms in animals at animal doses. It really is highly dangerous. It's irresponsible of any doctor, any politician, any pharmacist to tout this drug without any evidence that it works for COVID, and knowing that we don't know the dose, we don't know what it does if you have other diseases, we're not even sure what it does if you're taking other drugs with it.
And despite the dangers, some patients, or in the case of one prominent case, the family member of a patient who was in critical condition, have pushed doctors to actually administer ivermectin to treat COVID-19. And some doctors have obliged. In that case that I'm referring to, the courts forced the hospital system to oblige. What responsibilities do doctors and hospitals have?
In the case you're talking about, a judge basically said, I've got a doctor who wants to prescribe this drug to a dying person, dying man, and you should do it. That doctor didn't have privileges at the hospital, and the correct response is, I'm not doing that. I'm not giving a dangerous drug. I'm not giving a drug that might kill this person more quickly. Basically, the wife, understandably, wanted to throw him a life preserver. The problem is when you throw ivermectin, you're throwing a 100-pound rock that is very likely to tip over a dying person, cause their death to come earlier. I know people are desperate and looking around for treatments. They want to do something, anything they can think of. They see something promising on the internet and they believe it. That's not the place to get information, Lana. And again, we have to come back and say, you look at the side effects of ivermectin, you look at the damage being done, then you look at the vaccine and the problems that it has, which are next to nothing. Take the vaccine. Don't get in a position where you need to use something like ivermectin.
Are doctors who allow or are allowing their patients to use these types of treatment feeding into misinformation about the virus?
I think doctors and pharmacists who make this available, who order it, are misleading their patients. They have no data, no evidence that this is going to do any good. They have evidence galore that it could hurt or harm people. They don't know what doses or how often to give it. I think if you're doing this, my view is you should have your license examined and possibly revoked. You're basically practicing outside accepted standard of care.
You know, Arthur, there's going to be some people who hear this conversation and feel like doctors are trying to cut them off from a potential treatment, or that there's something political behind what you're saying. What do you say to those people, and what obligation do you think folks like yourself in the medical community have to fight against misinformation?
Well, I think you've got to speak out as we're doing, point out the dangers, point out the unknowns of a substance like ivermectin or other things that flourish up on the internet as potential treatments and cures, which have not panned out. We know if we had a cure that way, and we haven't seen any of these social media fad drugs do much of anything except hurt people. And I'd say, look, the manufacturer doesn't want you to take it. They're giving up the money they would make. Can you imagine the fortune they can make by selling this drug to everybody who got COVID? When they say don't do it, I think that's a pretty strong message that there's not a conflict there. When you have the AMA, the Pharmacy Association, the World Health Organization, all government agencies saying don't do it, that tells you they're singing in a chorus that you better be paying attention to. This isn't a case of somehow a conspiracy, don't use it because we're trying to cover up something valuable. You've got every medical group, every pharmacy group, trusted group saying this is not the answer.
All right, Arthur Caplan, thank you for giving us some context for this. Obviously, we can understand as people are faced with these terrible decisions that they're looking for answers, and we appreciate you helping to separate misinformation from truth. Thank you for all that you do.